This is Dr. Prasad, prosthodontist and implantologist, KIMS Hospital, both Secunderabad as well as Secunderabad Kondapur HOD. Today we are going to discuss about the hypersensitivity of the teeth. Normally, whenever we consume any cold drinks, ice creams or any hot things, we will feel that sensitivity is there and it increases in winter seasons especially. Why the sensitivity occurs? Normally, our teeth consist of external layer, protective layer called enamel, and below that protective layer is the dentin, and below that is the nerve structure. Whenever there is a damage to the enamel, wear off of the enamel, the dentin will expose directly to the outer environment, and for the cold and hot it activates and it directly sends the stimulus to the nerve tissue, where the nerve will send stimulus to the brain and we feel hot and cold sensitivity. Why this enamel got wear off? The first thing is decay. For any decay means decay is the just removing of the enamel and entering into the dentin. Because of the bacterial interaction with the starch and sugars, the acid will demineralize the enamel and dentin will expose. For this is one is decay, and second one is poor oral hygiene. When you don't have a good oral hygiene, the calculus and plaque accumulate and they demineralize the enamel or cementum between below the gingiva and it causes sensitivity. The third one is grinding. If you have a grinding habit and night grinding, especially which is called as a bruxism, the enamel will wear off. And fourth one is hard brushing. When you do hard brushings, what will happen? It will abrade the tissues, abrade the enamel, and the enamel will cut off and expose the dentin outer structure. This is because of using the abrasive toothpaste and the hard brush. And fifth one is after abrasion and erosion will be the cool drinks, whatever the drinks we are consuming, bicarbonate, soda drinks and all that, which demineralize the enamel and it exposes the this thing. And finally, when you have a gastric problem, and gastric problem, if it regurgitates, the acid reflux which comes out, enter into the mouth, and it again causes the demineralization of enamel and cause the sensitivity. And final one, if you have a fillings, old fillings which has a margins, leakage margins between the teeth and the filling, which again leads to the sensitivity. And next one is whenever you undergo procedures like scaling and oral prophylaxis, you will get sensitivity because immediately till that time the calculus is covered to the tooth structure. When you remove the calculus, immediately it exposed to the outer environment where it gives the sensitivity, but this is a temporary sensitivity. And next one is when you undergo any bleaching procedure also damages enamel and it also gives a sensitivity. And post orthodontic treatment also you will get the sensitivity. These are all the reasons to get a sensitive teeth. Then how will you diagnose the sensitive teeth? Sensitivity diagnosis, whenever if you flush any air or hot water or cool drink, or if you kept any ice, definitely immediately it gives a shoot up pain and you will get more sensitivity. That is the testing, where is the sensitive area. And what is the treatment modalities for this one? One is the home treatment and other one is the clinic treatment. Home treatment is just prescribing the desensitizing toothpaste, where you can apply the toothpaste in the mouth wherever you are feeling sensitivity and leave the toothpaste for 1 minute. After that you can brush that one, because the toothpaste is having sodium nitrate and potassium nitrate which clogs the open tubules, so that it prevents the direct stimulus from the dentin to the nerve. And the second thing is chewing gums. Whenever you chew fluoridated gums, the fluoride will form a protective layer on top of this one, which again helps this thing. And the next one is if still it is existing, if you should first stop the consuming cold or ice and consuming cool drinks. And finally, still if it is persisting, then go to a nearby dental surgeon. The dentist will take care of the sensitivity by applying a fluoridated coating on top of that, which directly clog the dentinal tubules. Fluoridates or oxalates or Sometimes with laser also we can do the desensitizing treatment. Still if it persists, then the final regime is going for a root canal treatment, and crowning is the final solution for this one. So if the problem is in an early stage, better to undergo treatment for that problem so that it won't land up into the bigger problem. Thank you.